Some nights, you look in the mirror and wonder if your best years are behind you. Nurse Elaine Morrison felt that way often these days, watching younger staff rush past her at Millbrook Community Hospital after 40 years of service. But on this quiet Tuesday evening, an elderly farmer walked through the emergency doors, with his face swollen beyond recognition. The man could barely speak, and what looked like a simple allergic reaction quickly became something much worse. When Elaine examined him closely, she felt something moving under his skin. The discovery sent the entire hospital into panic mode. Young nurses didn't know what to do, but Elaine's steady hands became their anchor. What was living inside the farmer's face that terrified experienced medical staff? Before we jump back in, tell us where you're tuning in from, and if this story touches you, make sure you're subscribed because tomorrow I've saved something extra special for you. Elaine Morrison had been pinning the same worn nursing badge to her scrubs for 40 years. The metal had dulled over the decades, much like she sometimes felt herself dulling in the bright fluorescent lights of Millbrook Community Hospital. At 62, she moved with the practiced efficiency of someone who had seen nearly everything emergency medicine could throw at her. Yet lately, she caught herself wondering if the younger staff saw her as a relic from another era. The hospital served a farming community of barely 8,000 souls scattered across Montana's rolling hills. Most nights, the emergency department saw little more than a sprained ankle from a weekend warrior, or an elderly resident with chest pains that turned out to be heartburn. Elaine preferred these quiet shifts. They gave her time to mentor the newer nurses without the chaos of a major trauma disrupting the teaching moment. On her desk sat a faded photograph from 1998, showing her with her late husband Robert and their twin daughters at a hospital Christmas party. The girls were 12 then, proud of their mother in her crisp white uniform. Now Sarah lived in Seattle with her own family, and Emma had moved to Denver for her law practice. They called every Sunday, but the conversations had grown shorter over the years, filled with polite updates about grandchildren she saw twice a year, and son-in-laws who remained pleasant strangers. Robert had been gone 5 years now, taken by the same type of sudden heart attack she had helped treat countless times in others. The irony wasn't lost on her that all her medical knowledge couldn't save the person who mattered most. His death had left her questioning many things, but mostly it made her realize how much of her life had been spent within these hospital walls. Instead of building memories at home, Dr. Sarah Chen, the young emergency physician who had joined the staff 2 years ago, often sought Elaine's guidance on difficult cases. At 31, Dr. Chen possessed the confidence that came with medical school training, but she lacked the intuitive understanding that only came from decades of patient care. Elaine appreciated being needed for her expertise, though she sometimes wondered if she was becoming too comfortable being the wise elder everyone turned to for answers. Marcus Williams, the night orderly, had worked alongside Elaine for 15 years. A gentle giant of a man who had taken the job after a back injury ended his construction career. Marcus understood the rhythms of the hospital better than most doctors. He knew which patients needed an extra blanket without being asked, and could sense when a family member needed a quiet moment alone with their loved one. His presence brought calm to chaotic situations, and Elaine had come to rely on his steady support during difficult shifts. The newest addition to their team was Jennifer Park, a recent nursing graduate who radiated enthusiasm for every aspect of patient care. At 24, she approached each case with textbook precision and genuine compassion, reminding Elaine of her own early years when every patient felt like a puzzle to solve and every successful outcome felt like a personal victory. Jennifer's eagerness sometimes made Elaine feel protective. She remembered how quickly the job could wear down that bright optimism if you weren't careful. The emergency department itself reflected the hospital's modest resources. 6 beds separated by curtains, 2 trauma bays that saw real action maybe once a month, and equipment that worked reliably despite showing its age. The staff had learned to make do with what they had, finding creative solutions when the latest technology wasn't available. In many ways, this limitation had made them better practitioners. They relied more on clinical judgment and hands-on assessment than their counterparts at larger facilities. Elaine, S shift routine had become as familiar as breathing. She arrived 30 minutes early to review the patient census and chat with the day shift nurses about ongoing cases. She checked supply levels, tested equipment, and made sure everything was ready for whatever the night might bring. These small rituals gave her comfort, anchoring her to a profession that had defined her adult life. Lately, though, she found herself questioning whether her methods were becoming outdated. The younger nurses learned procedures from updated textbooks and online training modules, while her knowledge came from experience and intuition developed over decades of practice. When Jennifer asked why she did something a certain way, Elaine sometimes struggled to explain the reasoning behind actions that had become automatic responses. The administration had been dropping hints about early retirement packages, suggesting that experienced staff might want to enjoy their golden years while they were still healthy enough to travel and pursue hobbies. The hints stung more than they intended, making Elaine wonder if she was holding back the department's progress by clinging to old ways of doing things. On this particular Tuesday evening, the emergency department was experiencing one of those rare lulls that made everyone slightly nervous. Experienced medical staff knew that quiet periods often preceded unexpected chaos, as if the universe was gathering energy for whatever crisis would soon unfold. Elaine used the downtime to organize supply closets and update patient charts, finding comfort in the mundane tasks that kept the department running smoothly. Dr. Chen was reviewing lab results at the nurses' station when she looked up and smiled at Elaine. "Quiet night," she said, then immediately looked concerned. "I probably shouldn't have said that out loud." Elaine chuckled. "Superstition is part of medicine, Dr. Chen, but we'll handle whatever comes through those doors, just like we always do." The confidence in her own voice surprised her. Despite her recent doubts about her relevance, something deep inside still believed in her ability to face any medical challenge. 40 years of experience had taught her that competence wasn't about having all the latest knowledge. It was about staying calm under pressure and knowing when to trust your instincts. As if summoned by their conversation about quiet nights. The automatic doors of the emergency entrance slid open with their familiar whoosh. The sound that had marked the beginning of countless medical emergencies was about to announce the arrival of a case that would test everything Elaine thought she knew about medicine and herself. The man who stumbled through the emergency doors looked like something from a medical textbook illustration of severe facial swelling. Harold Brennan, according to the driver's license his neighbor had pressed into Marcus's hands, was a 73-year-old farmer whose face had transformed into something barely recognizable as human. His features were so distorted by swelling that his eyes appeared as narrow slits, and his mouth seemed incapable of forming coherent words. "Found him like this about an hour ago," explained Beth Martinez, Harold's neighbor, who had driven him to the hospital. "He was trying to milk his cows, but he could barely stand up straight. I've never seen anything like it." Elaine immediately went into assessment mode, her trained eyes cataloging the patient's condition as Marcus helped Harold onto a gurney. The swelling wasn't uniform. It seemed concentrated around his left cheek and jaw, creating an asymmetrical appearance that suggested localized trauma or infection rather than a systemic allergic reaction. His breathing was labored but not critically compromised, indicating that the swelling hadn't yet affected his airway significantly. Dr. Chen appeared at Elaine's side, her expression shifting from routine concern to focused attention as she observed the patient's condition. "Mr. Brennan, can you tell me what happened?" she asked, speaking clearly and slowly. Harold's response came as a series of mumbled sounds that bore little resemblance to actual words. The swelling had affected his ability to move his jaw and tongue properly, making communication nearly impossible. Elaine could see the frustration in his eyes, the helplessness of being unable to explain his own medical emergency. "Let's get him into Trauma Bay 2, Dr. Chen directed. "Elaine, can you start a line and get vitals? Jennifer, I need you to call radiology and see how quickly we can get a CT of his head and neck." As they transferred Harold to the trauma bay, Elaine began her systematic assessment. His vital signs were elevated but not dangerously so. Heart rate of 98, blood pressure slightly elevated at 140/90, temperature of 99.4 degrees. The slight fever suggested infection or inflammation, but nothing that would explain the dramatic facial swelling. When did this swelling start? Elaine asked Beth, who had followed them into the trauma bay, despite Jennifer's attempts to redirect her to the waiting room. "That's the strange part," Beth replied, wringing her hands nervously. "I saw Harold yesterday afternoon, and he looked completely normal. His wife died 6 months ago, so I've been checking on him regularly. This morning when I went over with some fresh bread, I found him like this." Dr. Chen began her physical examination, carefully palpating the swollen areas while Harold winced in discomfort. "The swelling feels firm, almost like there's something solid underneath," she murmured, more to herself than to the others. "Mr. Brennan, I'm going to give you something for the pain, and then we need to figure out what's causing this." Elaine had been preparing the pain medication when something caught her attention. As she drew closer to start the IV, she noticed a subtle movement beneath the skin of Harold's left cheek, a slight rippling that didn't match his breathing or pulse. She paused, staring at the area more intently. "Dr. Chen," she said quietly, "could you look at this?" The young physician moved to where Elaine was pointing. For a moment, both women watched the skin on Harold's cheek. Then they saw it again, a definite movement that seemed to travel from one area to another, like something shifting position beneath the surface. "That's not possible," Dr. Chen whispered, but even as she spoke, they both saw it happen again. This time the movement was more pronounced, creating a visible bulge that moved from Harold's cheek toward his jaw. Harold's eyes widened in terror as he felt the sensation, and he began making more urgent sounds, trying desperately to communicate something important. Elaine took his hand and spoke in the calm, reassuring voice she had perfected over decades of comforting frightened patients. "Mr. Brennan, we're going to figure this out," she said firmly. "I need you to try to stay calm while we examine you more carefully." Dr. Chen's hands were visibly shaking as she put on fresh gloves. In her 2 years at the hospital, she had encountered many unusual cases, but nothing had prepared her for the possibility that something might be moving inside a patient's face. Her medical training provided no framework for this situation, and she found herself looking to Elaine for guidance. "Have you ever seen anything like this?" Dr. Chen asked quietly. Elaine shook her head, but her expression remained composed. "Nothing exactly like this, but I've learned that the human body can surprise you in ways medical school doesn't prepare you for. Let's focus on what we can observe and document." Jennifer returned from calling radiology, took one look at the patient, and immediately sensed the tension in the room. "Radiology can have him down there in 20 minutes, she reported, then noticed the worried expressions on everyone's faces. "Is everything all right?" Before anyone could answer, Harold made a desperate grunting sound and pointed to his cheek with a trembling finger. As they watched, the movement beneath his skin became more pronounced, creating a trail-like bulge that moved from his jaw toward his ear. Jennifer gasped audibly and stepped backward. "What is that?" Dr. Chen was struggling to maintain her professional composure, but Elaine could see the young physician was fighting panic. This was exactly the kind of situation where experience mattered more than textbook knowledge. Not because Elaine had encountered this specific problem before, but because she had learned to think systematically under pressure. "Jennifer, I need you to call Dr. Patterson at home," Elaine said, referring to the hospital's chief of staff. Tell him we have an unusual case that may require consultation with specialists. Dr. Chen, let's get some photos of what we're seeing and start documenting everything carefully." As Elaine spoke, she was already moving with purpose, gathering supplies and preparing for whatever steps might be necessary. Her calm efficiency helped steady the younger staff members, reminding them that even unprecedented situations could be approached with logic and careful observation. Harold's condition seemed to be evolving rapidly. The movement beneath his skin was becoming more frequent and more visible, and his obvious distress was increasing with each episode. Whatever was causing this phenomenon was not resolving on its own. If anything, it appeared to be getting worse. The trauma bay, which had seemed spacious moments earlier, now felt cramped and inadequate for the magnitude of what they were facing. Elaine realized that this case would likely require resources beyond what their small community hospital could provide. But first, they needed to stabilize Harold and determine exactly what they were dealing with. As she prepared to insert the AV line, Elaine felt the familiar surge of adrenaline that accompanied serious medical emergencies. Despite her recent doubts about her career, her body and mind were responding with the sharp focus that had served her well throughout 40 years of nursing. Whatever was happening to Harold Brennan, she was determined to help him through it. Dr. Patterson arrived within 15 minutes of Jennifer's call, still wearing the flannel shirt and jeans he had been gardening in when his phone rang. At 68, he had been Millbrook's chief of staff for over 2 decades, and his calm presence immediately brought a sense of authority to the increasingly tense situation in Trauma Bay 2. "Show me what we're dealing with," he said simply, washing his hands with the methodical care that came from decades of medical practice. Elaine positioned herself on Harold's left side, gently placing her fingers near the area where they had observed the movement. "Watch his left cheek just below the cheekbone," she instructed. As if responding to her words, the mysterious movement began again, a distinct rippling motion that traveled from Harold's jaw toward his temple. Dr. Patterson's eyebrows rose slightly, but his expression remained professionally neutral. "How long has this been occurring?" "We first noticed it about 20 minutes ago," Dr. Chen reported, her voice steadier now that the senior physician was present. "The movement seems to be increasing in frequency and intensity." Harold made another desperate sound, and his eyes darted between the medical staff gathered around him. Elaine could see the fear and frustration in his gaze, the terror of experiencing something inexplicable happening to his own body while being unable to communicate effectively. "Mr. Brennan, I'm Dr. Patterson," the chief of staff said, leaning closer to the patient. "We're going to take excellent care of you. Can you nod if you understand me?" Harold managed a slight nod, wincing as the movement seemed to trigger another episode of the strange shifting beneath his skin. Dr. Patterson began his own examination, his experienced hands carefully palpating the swollen areas. "The tissue feels firm, but not hard," he murmured. "There's definitely something foreign here, but it doesn't feel like a typical abscess or hematoma." Marcus appeared at the doorway with additional supplies Elaine had requested, including a portable ultrasound machine that the hospital used for basic diagnostic imaging. "Thought this might be helpful," he said, wheeling the equipment into the trauma bay. "Good thinking," Dr. Patterson approved. "Let's see if we can get a better look at what's going on underneath the surface." As Dr. Chen prepared the ultrasound equipment, Elaine continued monitoring Harold's vital signs and comfort level. The patient's anxiety was clearly escalating with each mysterious movement, and she knew that managing his fear was almost as important as addressing the medical mystery they faced. "Mr. Brennan, I know this is frightening," she said, taking his hand in hers. "We don't have all the answers yet, but we're going to stay right here with you until we figure this out. You're not alone in this." The ultrasound image that appeared on the monitor made everyone in the room fall silent. Instead of the uniform tissue density they expected to see, the screen showed what appeared to be a hollow, elongated structure moving through the tissue beneath Harold's cheek. The object, if it could be called that, seemed to be about 3 inches long and roughly cylindrical. "That's impossible," Jennifer whispered, staring at the screen in disbelief. Dr. Patterson adjusted the ultrasound probe, trying to get a clearer image. "It appears to be some kind of parasitic organism," he said slowly, as if he couldn't quite believe his own words. "I've read about cases like this in tropical medicine journals, but I never expected to see one in Montana." The implications of his statement hit everyone in the room simultaneously. If Harold was infected with some kind of parasite, there were serious questions about how he had contracted it, whether it was contagious, and what kind of treatment would be required. "Should we be taking isolation precautions?" Dr. Chen asked, voicing what everyone was thinking. "Let's err on the side of caution," Dr. Patterson replied. "Everyone in this room needs to wash thoroughly after we finish here, and we should consider moving Mr. Brennan to an isolation room until we know more." Elaine felt a chill run down her spine, but not from fear of contagion. She was thinking about Harold's isolation and terror, and how much worse those feelings would become if they moved him away from the familiar faces who had been caring for him. Sometimes medical protocols conflicted with human compassion and finding the right balance required wisdom that came only with experience. "Dr. Patterson," she said carefully, "before we isolate him, could we at least try to establish better communication? He's been trying to tell us something since he arrived, and it might be important for his diagnosis." The Chief of Staff considered her suggestion while studying the ultrasound image. "You're right. Jennifer, can you bring me a whiteboard and marker? Sometimes writing is easier than speaking when there's facial swelling." Harold's eyes lit up with hope when he saw the whiteboard. His first attempt at writing was shaky and difficult to read, but gradually the words became clearer. "Started 3 days ago. Felt like something crawling under skin. Thought I was going crazy." The timeline Harold provided changed their understanding of the situation significantly. If the symptoms had been developing for 3 days, this wasn't a sudden onset condition, but rather a progressive infection or infestation that had reached a critical point. "Can you tell us where you might have been exposed to something unusual?" Dr. Patterson wrote on the board. Harold's response came more quickly this time. "Working in Oban. Lots of insects. Found some kind of cocoons or egg sacs." Elaine felt pieces of a puzzle beginning to fall into place. Rural environments could harbor parasites that most medical professionals rarely encountered, especially in structures that hadn't been disturbed for years. Harold's farming background put him at risk for exposures that would be unlikely in other patients. "We need to contact the State Health Department," Dr. Patterson said. "This could be a reportable condition, and they'll have access to specialists who deal with unusual parasites." As if responding to their growing understanding of the situation, the movement beneath Harold's skin became more pronounced. The ultrasound showed the organism moving with what appeared to be increased agitation, possibly responding to the examination or to Harold's elevated stress levels. "It's getting more active," Dr. Chen observed, watching both the patient and the monitor. "Should we consider sedation to keep him calm?" Before Dr. Patterson could answer, Harold grabbed Elaine's wrist with surprising strength and pointed urgently to the whiteboard. His message, written in increasingly shaky handwriting, made everyone in the room understand why he had been so desperate to communicate. "There's more than one." Harold's revelation that there were multiple organisms beneath his skin transformed the trauma bay into a command center of urgent activity. Dr. Patterson immediately began making phone calls, while Dr. Chen and Elaine continued monitoring the patient, who seemed to grow more agitated as the reality of his situation became clear to everyone around him. "I'm calling Dr. Elizabeth Hartley at the State University," Dr. Patterson explained between calls. "She's a parasitologist who consults on unusual cases like this. If anyone knows what we're dealing with, it'll be her." Elaine watched Harold's face carefully as they repositioned the ultrasound probe to examine different areas. The fear in his eyes had evolved into something deeper, a profound sense of violation that came from knowing his own body had been invaded by foreign organisms. She had seen this expression before in patients with serious diagnoses, the moment when they realized their lives had fundamentally changed. "Mr. Brennan," she said softly, "we're going to get through this together. I know it feels overwhelming right now, but you're in good hands." The ultrasound revealed what Harold had tried to tell them. There were at least 3 distinct organisms, visible in the imaging, all appearing to be similar in size and shape to the first one they had detected. They seemed to be moving independently of each other, creating a disturbing pattern of activity beneath the swollen tissue. Jennifer had been taking detailed notes and photographs of everything they observed, but Elaine could see that the young nurse was struggling with the unprecedented nature of the case. Her training had prepared her for many medical emergencies, but nothing like this parasitic infestation that seemed more like something from a science fiction movie than real medicine. "Jennifer," Elaine said quietly, "why don't you call the lab and see if they can prepare for some unusual specimens? We may need to do some testing that's outside our normal protocols." The suggestion gave Jennifer something concrete to focus on, which Elaine knew would help her maintain her professional composure. Sometimes the best way to handle shocking situations was to break them down into manageable tasks that felt familiar and routine. Dr. Chen had been studying the ultrasound images with intense concentration. "The organisms appear to be encapsulated," she observed. "They're not just loose in the tissue. There seems to be some kind of membrane or casing around each one." This observation provided their first real clue about what they might be dealing with. Encapsulated parasites suggested a specific type of life cycle, possibly involving insect vectors or environmental exposure that allowed the organisms to establish themselves in human tissue. That matches with what Harold wrote about finding cocoons or egg sacs in his barn, Elaine noted. He may have disturbed some kind of breeding site. Harold's condition seemed to be stabilizing somewhat, though the movement beneath his skin continued at regular intervals. His vital signs remained elevated but not dangerously so, and his breathing was adequate despite the facial swelling. Most importantly, he appeared to be managing his fear better, now that the medical team was taking his situation seriously and working actively to help him. Dr. Patterson returned from his phone consultations with both good news and concerning information. "Dr. Hartley is driving down from the university. She'll be here in about 2 hours. She's fairly certain we're dealing with a type of botfly larva based on what I've described." "Botflies?" Dr. Chen asked. "I thought those were primarily found in Central and South America." "Most species are," Dr. Patterson confirmed. "But there are some North American varieties, and climate changes have been expanding their range northward. Dr. Hartley says she's seen similar cases in agricultural workers who've been exposed to infested livestock facilities. The identification of their likely diagnosis provided some relief, but it also raised new questions about treatment and potential complications. Botfly larvae were known to cause serious infections if not removed properly, and the presence of multiple organisms in Harold's face made the situation particularly complex. "The good news," Dr. Patterson continued, "is that these organisms typically don't reproduce inside the human host. The bad news is that removal can be tricky, and we'll need to be very careful not to damage surrounding tissue or allow any of the larvae to rupture during extraction." Harold had been listening to their discussion, and Elaine could see both relief and continued worry in his expression. The knowledge that his condition had a name and a potential treatment was clearly comforting, but the prospect of having multiple larvae surgically removed from his face was understandably frightening. "Mr. Brennan," Dr. Patterson addressed the patient directly, We're going to move you to a private room where you'll be more comfortable while we wait for our specialist to arrive. The removal procedure will likely happen tonight, but we'll make sure you're properly sedated and pain-free throughout the process." As they prepared to transfer Harold to his room, Elaine reflected on how the night had evolved from a routine shift to one of the most unusual cases of her career. The initial panic and confusion had given way to systematic problem-solving, and she felt a familiar sense of satisfaction that came from working as part of a medical team facing a challenging situation. "Elaine," Dr. Patterson said as they moved, Harold's gurneyed toward the elevator, "I want you to stay as his primary nurse through this case. Your experience and calm presence have been invaluable tonight." The assignment felt like both a professional compliment and a personal validation. Despite her recent doubts about her relevance in modern medicine, this case had reminded her that clinical experience and intuitive patient care remained essential elements of nursing practice. Jennifer walked alongside the gurney, still taking notes and ensuring all of Harold's belongings and medical records were properly organized. "I've never seen anything like this," she admitted to Elaine quietly. "How do you stay so calm when everything seems so uncertain?" 40 years of practice," Elaine replied with a slight smile, "and the knowledge that even the most unusual cases usually have logical explanations and effective treatments. We just have to be patient and systematic about finding them." As they settled Harold into his isolation room, Elaine realized that this case represented exactly the kind of situation where her years of experience provided value that couldn't be replaced by newer technology or updated protocols. Sometimes, medicine required the wisdom that came only from having seen the human body's capacity for both illness and healing in all its varied forms. Dr. Elizabeth Hartley arrived at Millbrook Community Hospital like a small whirlwind of academic energy and practical expertise. At 45, she had spent the better part of 2 decades studying parasitic organisms, and her reputation for handling unusual infestations had made her the go-to consultant for cases that stumped other medical professionals. "Where's my patient?" she asked without preamble, shaking hands quickly with Dr. Patterson while her eyes scanned the hallway for directional signs to Harold's room. Elaine found herself impressed by the specialist's direct approach and obvious competence. In her experience, the best doctors were those who focused immediately on patient care rather than getting caught up in the academic curiosities of unusual cases. "Room 312, Elaine replied, leading the way. "He's been stable since we moved him, but the movement activity seems to be increasing." Dr. Hartley nodded as they walked. "That's typical for botfly larvae at this stage of development. They're probably getting ready to emerge naturally, which means we need to act quickly before they attempt to exit on their own." The explanation made Harold's situation feel both more urgent and more hopeful. If the organisms were following a natural life cycle, their removal could be timed to work with their biology rather than against it. Harold was awake when they entered his room, though he appeared exhausted from the stress of the day's events. His face remained significantly swollen, and the periodic movement beneath his skin had become more pronounced and frequent. "Mr. Brennan?" "I'm Dr. Hartley," the specialist said, approaching his bedside with the same direct manner she had shown in the hallway. "I study organisms like the ones that have taken up residence in your face. I'm here to get them out safely." Her matter-of-fact approach seemed to comfort Harold, who had been dealing with medical professionals tiptoeing around his condition all evening. Sometimes patients appreciated honesty more than gentle euphemisms, especially when they were facing something genuinely frightening. Dr. Hartley's examination was thorough and systematic. She used both the ultrasound equipment and her own hands to map the location of each larva, taking photographs and making detailed sketches in a leather-bound notebook that looked like it had seen many similar cases. 4 larvae total, she announced after completing her assessment. 3 in the left cheek and 1 smaller one near the jawline. They're all encapsulated and appear to be healthy specimens. Healthy? Jennifer asked, looking confused. Is that good or bad? Good. For Mr. Brennan, Dr. Hartley explained. Healthy larvae are easier to remove intact. If they were dying or infected, the removal would be much more complicated and potentially dangerous. The specialist's confidence was infectious. Her obvious expertise and practical approach to what had seemed like an impossible situation helped everyone in the room feel more optimistic about Harold's prospects for recovery. The removal procedure is straightforward, but requires patience, Dr. Hartley continued. We'll make small incisions over each larva and extract them using forceps. The key is to avoid rupturing the larvae during removal, which could cause significant inflammation and infection. Dr. Patterson had been listening carefully to the treatment plan. Will this require general anesthesia? Local anesthesia should be sufficient, Dr. Hartley replied. Mr. Brennan will be more comfortable and will have better control over the procedure. I've done hundreds of these extractions, and most patients tolerate them quite well. Harold looked visibly relieved at the prospect of remaining conscious during the procedure. Elaine understood his preference. After spending the day feeling like his body was out of his control, staying awake would help him feel more involved in his own treatment. As the medical team prepared for the extraction procedure, Elaine found herself reflecting on how the case had evolved from a mysterious medical emergency into a manageable, if unusual, surgical intervention. The transformation illustrated something she had learned over decades of nursing. Most medical mysteries had logical explanations once you found the right expertise and approached them systematically. Elaine, Dr. Hartley said, I'd like you to assist with the procedure if you're comfortable with that. I prefer working with experienced nurses who can anticipate what I need and help keep the patient calm during the extraction. The request felt like a professional honor. Dr. Hartley's reputation meant that assisting her would be both a learning experience and a validation of Elaine's clinical skills. I'd be happy to help, Elaine replied, already mentally preparing for the procedure. The operating room they would use was the hospital's smaller surgical suite, typically reserved for minor procedures and emergency surgeries. Marcus helped prepare the space, while Jennifer gathered the specialized instruments Dr. Hartley had requested from her medical kit. Harold was transferred to the surgical suite on a gurney, and Elaine could see that despite his relief about the treatment plan, he was still anxious about the upcoming procedure. She walked alongside him, providing the kind of reassuring presence that she had perfected over 40 years of caring for worried patients. Mr. Brennan, you're going to do fine, she said as they entered the operating room. Dr. Hartley is one of the best at this type of procedure, and we'll be right here with you the entire time. The preparation for surgery gave Elaine a familiar sense of purpose and competence. Her hands moved automatically through the routines of surgical setup, preparing instruments, organizing supplies, ensuring everything was sterile and properly arranged. These were skills that had remained constant throughout her career, even as medical technology and procedures had evolved around them. Dr. Hartley worked with the efficient movements of someone who had performed the same procedure many times before. Her technique was precise but unhurried, and she maintained a running commentary that helped both Harold and the assisting staff understand what was happening at each step. The first incision will be over the largest larva, she explained, as she administered the local anesthetic. Mr. Brennan, you'll feel some pressure but no pain. Let me know immediately if you feel any discomfort. As the procedure began, Elaine found herself fully engaged in the technical aspects of the surgery, while simultaneously monitoring Harold's emotional state and physical comfort. The dual focus required exactly the kind of experienced judgment that she had been questioning about her own abilities. The ability to multitask effectively while maintaining high standards in multiple areas simultaneously. The first larva came out intact, a white, segmented organism about 3 inches long that looked disturbingly alive even after extraction. Harold's visible relief was immediate and profound, as if a physical and psychological burden had been lifted from him. The extraction of the second larva proved more challenging than the first. This organism had positioned itself deeper in Harold's cheek tissue, requiring Dr. Hartley to make a slightly larger incision and work more carefully to avoid damaging surrounding nerves and blood vessels. "This one's been busy," Dr. Hartley murmured as she worked, her forceps probing gently beneath the swollen tissue. "It's created quite a network of tunnels in there." Harold remained remarkably calm throughout the procedure, though Elaine could see tension in his grip on the surgical table's side rails. She placed her hand over his, providing the human contact that sometimes meant more to patients than any medication or technical intervention. "You're doing beautifully, Mr. Brennan," she said quietly. "We're almost halfway done." Dr. Chen had been observing the procedure with fascination and horror in equal measure. As a young physician, she had never encountered anything like parasitic infestations, and the learning experience was both valuable and unsettling. "How common are these cases?" she asked Dr. Hartley during a brief pause in the extraction. "More common than most people realize," the specialist replied, while examining the second extracted larva. "Climate change is expanding the range of many parasitic species, and increased international travel means we're seeing organisms in places they've never been before. I get called for cases like this about once a month now." The information put Harold's situation into a broader context that made it seem less bizarre and more like part of an emerging pattern in modern medicine. Elaine found this perspective comforting. It suggested that unusual cases like this might become more routine as medical professionals gained experience with changing disease patterns. The third larva presented a different challenge. Located near Harold's jawline, it had positioned itself close to important facial nerves that controlled muscle movement and sensation. Dr. Hartley's approach became even more cautious as she worked to extract it without causing permanent damage. "This is the tricky one," she explained to Harold. "I need you to tell me immediately if you feel any tingling or numbness in your lips or tongue." Harold nodded carefully, his eyes fixed on Dr. Hartley's hands as she worked with microscopic precision around delicate anatomical structures. Elaine admired the specialist's combination of technical skill and clear communication. She kept Harold informed without alarming him unnecessarily. As Dr. Hartley worked on the third extraction, Elaine found herself thinking about the broader implications of the case. Harold was a 73-year-old farmer who had lived his entire life in rural Montana, yet he had been infected by organisms that were typically associated with tropical climates. The changing world was bringing new medical challenges to places like Millbrook, and healthcare providers would need to adapt their knowledge and skills accordingly. "Got it," Dr. Hartley announced with satisfaction as the third larva came free. This one was slightly smaller than the first two, but appeared equally healthy and well-developed. Harold's relief was visible as the tension left his facial muscles. 3/4 of his ordeal was over, and the successful extractions had proven that the procedure was both safe and effective. Jennifer had been documenting the entire process with photographs and detailed notes, creating a record that would be valuable for medical education and research. Cases like Harold's were rare enough that thorough documentation could help other healthcare providers who might encounter similar situations in the future. "The fourth larva is the smallest," Dr. Hartley noted as she prepared for the final extraction. "It's located in an easier spot, so this should go quickly." The final organism came out smoothly, completing the procedure without complications. Harold's face, while still swollen from the trauma of the extractions, no longer showed the disturbing movement that had characterized his condition throughout the day. "All done, Mr. Brennan," Dr. Hartley said, beginning to close the surgical sites with small sutures. "You're officially larva-free." Harold's attempt at a smile was hampered by the local anesthesia and surgical swelling, but his eyes conveyed profound gratitude and relief. He had entered the hospital as a frightened man with an inexplicable condition, and he was leaving the operating room as a patient with a successfully treated medical problem. As they moved Harold to the recovery area, Elaine reflected on how the case had challenged and ultimately validated her professional abilities. The unusual nature of the diagnosis had required exactly the kind of experienced clinical judgment and patient advocacy that she had been doubting about her own relevance. "Elaine," Dr. Hartley said as they settled Harold into his recovery room, "you were excellent in there. Your patient care and surgical assistance were exactly what this case required." The compliment from such a respected specialist felt deeply meaningful. It reminded Elaine that her decades of experience had value that couldn't be replicated by newer training or updated technology. There was no substitute for the intuitive understanding of patient needs that came only from years of practice. Harold would need to stay overnight for observation, but his prognosis was excellent. The extraction sites would heal normally, and there was no risk of reinfection from the organisms that had been removed. In a few weeks, the entire episode would be nothing more than an unusual story to tell his neighbors. Dr. Patterson appeared in the recovery room as Harold was waking up from the light sedation he had received during the final stages of the procedure. "How did everything go?" "Textbook extraction," Dr. Hartley reported. 4 healthy larvae, all removed intact, no complications. Mr. Brennan should make a full recovery with minimal scarring. As the medical team discussed Harold's post-operative care and discharge planning, Elaine found herself feeling energized rather than exhausted, despite the long and stressful day. The successful resolution of such an unusual case had reminded her why she had chosen nursing as a career, the satisfaction of helping people through their most vulnerable moments and seeing them emerge healthy and whole on the other side. The case had also demonstrated something important about the value of experience in medicine. While Dr. Hartley had provided the specialized knowledge needed for diagnosis and treatment, the successful outcome had required the combined efforts of the entire medical team, each contributing their own expertise and experience to Harold's care. Jennifer approached Elaine as they prepared to transfer Harold back to his regular room for overnight observation. "Thank you for staying calm. Through all of this," the young nurse said, "I learned so much from watching how you handled such an unusual situation." 3 hours after Harold's successful surgery, Elaine was completing her post-operative documentation when her phone rang. The caller ID showed Beth Martinez's number, Harold's neighbor who had brought him to the hospital earlier that evening. "Nurse Morrison, I'm sorry to bother you so late, but something terrible has happened." Beth's voice was shaking with fear and exhaustion. "My husband Tom, he's got the same swelling Harold had, but it's much worse. His whole face is distorted and he can barely breathe." Elaine felt her stomach drop. If Tom Martinez was showing similar symptoms, it meant the parasitic infestation wasn't an isolated incident, but potentially part of a larger outbreak. The implications were staggering. How many other people might have been exposed to whatever had infected Harold? "Beth, you need to bring Tom to the hospital immediately," Elaine said, already moving toward Harold's room to alert Dr. Patterson and Dr. Hartley. "Don't wait, come now." She found Dr. Hartley in Harold's room, checking on her patient's post-surgical recovery. Harold was awake and alert, the swelling in his face already beginning to subside now that the larvae had been removed. "Dr. Hartley, we may have another case," Elaine reported quietly, explaining Beth's phone call. "If there are 2 patients with the same condition, we need to start thinking about this as a potential outbreak." Dr. Hartley's expression shifted from post-surgical satisfaction to serious concern. 2 cases suggests a common source of exposure. We need to contact the county health department immediately and start implementing outbreak protocols. Dr. Patterson, who had been reviewing Harold's chart, looked up with alarm. "An outbreak? Are we talking about something contagious?" "Not contagious in the traditional sense," Dr. Hartley explained. Bot fly larvae don't spread person to person. But if multiple people are infected, it means there's an environmental source that's actively producing infestations. Probably an area with high concentrations of adult flies looking for hosts. Harold had been listening to their conversation, and he struggled to sit up in his hospital bed. Despite the lingering effects of the local anesthesia, he managed to speak more clearly than he had since arriving at the hospital. "Tom was helping me in the barn yesterday," he said slowly but distinctly. "We were cleaning out the old storage area where I found those cocoon things. He was there for about 3 hours." The revelation provided a crucial piece of information about the source of the outbreak. Harold's barn wasn't just the site of his own exposure. It was actively infecting anyone who spent time there. The implications were frightening when Elaine considered how many people in their farming community might have helped Harold with various projects over the past few weeks. "We need to quarantine that barn immediately," Dr. Hartley said. "And we need to identify anyone else who might have been exposed." Before anyone could respond, the emergency department doors burst open with the unmistakable sound of a medical crisis arriving. Marcus appeared in Harold's doorway moments later, his face grim with concern. "Tom Martinez is here," he reported. "His condition is much worse than Harold's was. The swelling has spread to his throat, and he's having trouble breathing." Elaine felt the familiar surge of adrenaline that accompanied serious medical emergencies. But this time, it was complicated by the knowledge that Tom's condition represented something larger and more dangerous than a single unusual case. They were dealing with an active infestation site that could potentially affect dozens of people in their small community. Tom Martinez was indeed in worse condition than Harold had been. The farmer was a large man in his 50s, but the parasitic swelling had distorted his features beyond recognition. More alarming, the infestation had spread to his neck and throat area, causing the breathing difficulties that had prompted Beth's frantic call. "Get him to Trauma Bay 1, Dr. Patterson ordered, "and call respiratory therapy. We may need to establish an emergency airway." Dr. Hartley began her examination while the medical team worked to stabilize Tom's breathing. The ultrasound revealed a more extensive infestation than they had seen in Harold. At least 6 larvae distributed across his face and neck, with some positioned dangerously close to critical structures. "This is going to be much more complicated than Harold's surgery," Dr. Hartley said quietly to Dr. Patterson. "Some of these larvae are in positions where extraction could be life-threatening." As Tom was prepared for emergency surgery, Elaine found herself coordinating multiple aspects of the crisis simultaneously. She was helping to manage Tom's immediate medical needs, while also trying to gather information about potential additional exposures and contacting health authorities about the outbreak. Beth Martinez provided crucial information about the timeline of her husband's exposure and symptoms. "Tom started feeling something strange on Sunday night," she reported, "but he thought it was just allergies from all the dust and cobwebs in Harold's barn. By this morning his face was starting to swell, but we thought it was related to his blood pressure medication." The progression from initial exposure to severe symptoms had occurred over the same time frame as Harold's case, but Tom's infestation was significantly more severe. Dr. Hartley theorized that he might have been exposed to a higher concentration of parasites, or that his individual immune response had allowed the organisms to establish themselves more extensively. "Beth, I need you to think carefully," Elaine said. "Was anyone else with you and Tom when you were working in Harold's barn? Any neighbors, family members, hired help?" Beth's face went pale as she considered the implications of the question. "My teenage grandson Jake was there on Sunday. He helped carry some of the old equipment out to the truck. And I think the Peterson boys from down the road stopped by to see if Harold needed help with anything." The potential scope of the outbreak was expanding rapidly. If multiple teenagers and young adults had been exposed, they could be dealing with cases scattered throughout the county, Worse, younger patients might not recognize the early symptoms or might delay seeking medical attention. Harold, who had been listening to the conversation from his hospital bed, provided another disturbing piece of information. "That barn hasn't been opened in over 2 years," he said. "Not since my wife got sick. When we finally went in there. This weekend, it was like disturbing some kind of nest. There were insects everywhere, more than I'd ever seen in one place." Dr. Hartley's expression grew increasingly grave as she absorbed the implications of Harold's description. A bot fly breeding site that had been undisturbed for 2 years would have reached extraordinary levels of population density. Anyone entering that environment would have been exposed to hundreds or thousands of parasites looking for hosts. By midnight, Millbrook Community Hospital had transformed from a quiet rural medical facility into the command center for what the county health department had officially classified as a parasitic outbreak. Dr. Hartley was preparing for Tom Martinez's complex surgery, while Elaine coordinated with health officials to track down everyone who might have been exposed to Harold's infested barn. The county health director, Dr. Patricia Wilson, had arrived with a team of epidemiologists and public health nurses. Their presence brought resources and expertise, but it also highlighted the seriousness of the situation facing their small community. "We've identified at least 8 people who had contact with the barn site over the past week," Dr. Wilson reported during an emergency meeting in the hospital conference room. 3 teenagers, 2 adult neighbors, Harold's nephew who drove up from Billings, and 2 agricultural extension workers who were consulting on Harold's crop rotation plans. Elaine felt the weight of responsibility settling on her shoulders. As the primary nurse for both Harold and Tom, she had become the hospital's point person for managing the medical aspects of the outbreak, while public health officials handled the broader community response. "How do we locate and examine 8 people spread across 2 counties in the middle of the night?" Dr. Patterson asked, voicing what everyone was thinking. "We start with the local cases and work outward," Dr. Wilson replied. "The Peterson boys live just 5 miles from here. Jake Martinez is staying at his grandmother's house in town. If we can get those 3 examined tonight, we'll have a better sense of how widespread this infestation might be." Dr. Hartley emerged from the surgical suite where she had been evaluating Tom Martinez's case. Her expression was grave as she addressed the assembled group. "Tom's surgery is going to take at least 4 hours, she announced. 2 of the larvae are positioned near major blood vessels, and 1 is close to his airway. This is going to require microsurgical precision to avoid potentially fatal complications." The news added urgency to their efforts to locate other potential victims. If Tom's condition was any indication, people who had been exposed to the barn environment were facing potentially life-threatening medical emergencies that would develop over the next few days. Elaine volunteered to accompany the public health team on their emergency house calls. Her presence would provide medical expertise if they discovered additional cases, and her reputation in the community would help convince worried families to cooperate with the health investigation. "I'll stay here to assist with Tom's surgery," Jennifer offered. "Dr. Hartley will need an experienced surgical nurse, and I want to learn as much as possible about these procedures." The young nurse's willingness to take on additional responsibility impressed Elaine. The crisis was bringing out the best in everyone on their medical team, demonstrating the kind of professional growth that occurred when people were challenged to perform beyond their normal duties. Marcus had been quietly organizing the hospital's resources to handle multiple potential patients simultaneously. "I prepared 3 additional isolation rooms," he reported, "and I've contacted our equipment suppliers about getting additional ultrasound machines in case we need to examine multiple patients at the same time." His practical approach to crisis management reflected the kind of institutional knowledge that came from years of working in emergency medicine, While others focused on the medical complexities of the outbreak, Marcus was ensuring that they would have the physical resources necessary to handle whatever they discovered. The first stop on their emergency rounds was the Peterson farm, where brothers Danny and Mike Peterson, ages 16 and 18, lived with their parents. Beth Martinez had called ahead to explain the situation, so the family was waiting anxiously when the health team arrived. Both teenagers showed early signs of facial swelling, though neither case was as advanced as Harold's had been when he first arrived at the hospital. The early detection was encouraging. It suggested that prompt treatment could prevent the severe complications they were seeing in Tom Martinez. "We need to get both boys to the hospital immediately," Elaine told their parents. "The earlier we can treat this condition, the better their outcomes will be." The Peterson parents were frightened but cooperative, understanding that their sons were facing a serious medical emergency that required immediate professional intervention. The family's trust in Elaine's judgment reflected her reputation in the community and demonstrated why experienced nurses were so valuable during crisis situations. Jake Martinez, Harold's 17-year-old grandson, presented a more complex case. The teenager had been experiencing mild facial swelling for 2 days, but had attributed it to seasonal allergies. His symptoms were more advanced than the Peterson brothers, but not as severe as his grandfather Tom's condition. "Jake, we need to take you to the hospital right now," Elaine explained to the frightened teenager. "You've been infected with the same parasites that made your grandfather sick, but we can treat you successfully if we act quickly." The young man's fear was understandable. He had watched his grandfather's face become grotesquely swollen and knew that his grandfather Tom was currently in surgery for a life-threatening condition. Elaine's calm reassurance and clear explanation of the treatment process helped convince him to cooperate with the medical team. By 2 in the morning, Millbrook Community Hospital was treating 3 additional parasitic infestation cases while Tom Martinez remained in surgery. The Peterson brothers required relatively simple extractions similar to Harold's original procedure, but Jake Martinez needed more extensive treatment due to the advanced state of his infection. Dr. Wilson had been coordinating with state health officials to locate the remaining potential exposure victims. Harold's nephew had returned to Billings and was being examined at a larger medical facility there, while the agricultural extension workers were being contacted at their homes in the county seat. This is the largest botfly outbreak ever documented in this region, Dr. Wilson told Elaine during a brief break between patient examinations. "Your hospital's response has been exemplary. You've prevented what could have become a much more serious public health crisis." The recognition felt good, but Elaine was more focused on ensuring that all their patients received the best possible care. The night had tested every aspect of their small hospital's capabilities, from surgical resources to infection control protocols to staff endurance. Dr. Hartley emerged from Tom Martinez's surgery, looking exhausted but satisfied. "All 6 larvae extracted successfully," she reported. "It was touch and go with the ones near his carotid artery, but we managed to get them out without damaging any critical structures." The successful completion of the most difficult case provided a sense of relief for the entire medical team. If they could handle Tom's complex infestation, the remaining cases would be manageable with the procedures and protocols they had developed. Throughout the night, Harold, who had been kept informed about the outbreak developments, expressed both gratitude and guilt about his role in exposing others to the parasites. "I should have realized something was wrong with that barn," he said to Elaine during one of her check-ins on his recovery. "All those insects should have been a warning sign. Mr. Brennan, you couldn't have known what you were dealing with." Elaine reassured him. "These organisms aren't something most people would recognize as dangerous. The important thing is that we've identified the source and prevented further exposures." As dawn approached, the immediate crisis was resolving into manageable individual cases. The outbreak had been contained, The source had been quarantined, and all known victims were receiving appropriate treatment. What had begun as one unusual patient had evolved into a complex public health emergency that tested every aspect of their rural hospital's capabilities. At 4 in the morning, just as Elaine thought the outbreak crisis was finally under control, everything changed. Jake Martinez, who had been recovering well from his larval extraction surgery, suddenly developed severe complications that sent the medical team scrambling to save his life. "His blood pressure is dropping rapidly," Jennifer called out from Jake's room, her voice tight with concern, "and he's showing signs of anaphylactic shock." Elaine rushed to Jake's bedside, her mind racing through possible causes for the teenager's sudden deterioration. The extraction procedure had gone smoothly, with no apparent complications, but something was clearly going very wrong with his recovery. Dr. Chen was already at the patient's side, administering emergency medications to counteract the allergic reaction that seemed to be threatening Jake's life. "His airways are starting to constrict," she reported. "We may need to intubate if this doesn't respond quickly to treatment." Dr. Hartley appeared in the doorway, drawn by the commotion. She had been catching a brief rest after Tom Martinez's successful surgery, but the emergency with Jake demanded her immediate attention. "This shouldn't be happening," she said, quickly examining the teenager while the other medical staff continued their resuscitation efforts. Botfly extractions don't typically cause delayed allergic reactions like this. The mystery of Jake's sudden illness added a terrifying new dimension to the outbreak. If the standard treatment protocol was causing life-threatening complications, everything they thought they understood about managing these cases was potentially wrong. Elaine found herself coordinating the emergency response while simultaneously trying to understand what had gone wrong. Her 40 years of nursing experience had taught her that medical crises often revealed hidden factors that hadn't been apparent during initial treatment. "Dr. Hartley, could this be related to something other than the extraction?" she asked, while helping to prepare emergency intubation equipment. "Maybe something specific to Jake's case that we missed?" The specialist was examining the extraction, a sight, when she made a discovery that changed everything. "There's still something here," she announced grimly. "The ultrasound is showing another organism, but this one is different from the others we removed." The revelation that Jake still harbored an unextracted parasite explained his complications, but it raised disturbing questions about how thoroughly they had examined all their patients. If Jake had a different type of organism alongside the botfly larvae, other patients might be facing similar hidden dangers. "We need to re-examine everyone immediately," Dr. Patterson ordered, understanding the implications of Dr. Hartley's discovery. "If Jake has multiple types of parasites, the others might too." The emergency re-examination of Harold, Tom Martinez, and the Peterson brothers revealed what Dr. Hartley described as the worst-case scenario for parasitic infestations. All of the patients harbored secondary organisms that had been missed during their initial treatments, tiny parasitic worms that had used the botfly larvae as vectors to establish themselves in human tissue. "This is unprecedented," Dr. Hartley said, her professional composure finally showing cracks under the strain of the evolving crisis. "I've never seen co-infections like this. The botflies must have been carrying these secondary parasites when they infected their human hosts." Jake's condition was deteriorating despite aggressive treatment. The secondary parasite in his system was releasing toxins that were causing the severe allergic reaction threatening his life. Without immediate intervention to remove the remaining organism, the teenager faced potential organ failure and death. "We need to get him back to surgery immediately," Dr. Hartley decided, "but this extraction is going to be much more dangerous than anything we've done tonight. These secondary parasites are microscopic and can be anywhere in his circulatory system." Elaine felt the weight of the crisis settling heavily on her shoulders. Jake Martinez was someone's grandson, a teenager, who should have been worrying about homework and weekend plans instead of fighting for his life against exotic parasites. The transformation from routine medical case to life-threatening emergency illustrated how quickly things could change in medicine. "I'll assist with the surgery," she told Dr. Hartley, knowing that her experience and calm presence would be crucial during such a complex and dangerous procedure. The surgical team that assembled for Jake's emergency operation represented the full resources of Millbrook Community Hospital. Dr. Chen would manage anesthesia and respiratory support, while Marcus prepared specialized equipment for microscopic parasite detection. Jennifer coordinated with the blood bank for potential transfusion needs. As they wheeled Jake into the operating room, Elaine caught sight of Harold Brennan standing in his doorway, watching with obvious distress as his grandson was rushed to emergency surgery. The elderly farmer's expression conveyed both fear for Jake's life and guilt about his role in the outbreak that had endangered multiple families. "Mr. Brennan, Jake is going to be fine," Elaine told him, though she wasn't certain she believed her own words. "Dr. Hartley is one of the best in the country at this type of procedure." The surgery that followed would test every aspect of Dr. Hartley's expertise and the hospital's capabilities. Using microscopic visualization techniques, the surgical team would need to locate and extract parasitic worms that were nearly invisible to the naked eye while avoiding damage to Jake's vital organs. The procedure began with Dr. Hartley making tiny incisions to access the areas where the ultrasound had detected secondary parasitic activity. Under high magnification, she could see the thread-like organisms moving through Jake's tissue, causing the inflammatory response that was threatening his life. "These parasites are unlike anything in the medical literature," she murmured, as she worked with microscopic precision. "They seem to have evolved specifically to use botfly larvae as transportation to human hosts. The extraction process required patience and technical skill that pushed everyone in the operating room to their limits. Each parasite had to be isolated and removed individually, while the team monitored Jake's vital signs for any indication that the procedure was causing additional complications. Elaine found herself functioning as both surgical assistant and patient advocate, ensuring that Jake's medical needs remained the primary focus while the team dealt with the technical challenges of an unprecedented procedure. Her role required the kind of experienced judgment that couldn't be taught in nursing school, the ability to balance multiple competing priorities under extreme pressure. After 3 hours of microscopic surgery, Dr. Hartley finally extracted the last of the secondary parasites from Jake Martinez's system. The teenager's vital signs immediately began to stabilize as the toxic inflammatory response subsided, but the ordeal had pushed his young body to its limits. "That's all of them," Dr. Hartley announced with exhausted relief. 7 microscopic parasitic worms, each one capable of causing the systemic reaction we saw. Elaine monitored Jake's recovery while the surgical team completed the procedure. The teenager's color was improving, and his breathing had returned to normal patterns. Most importantly, the dangerous allergic reaction that had threatened his life was resolving as his immune system stopped fighting the foreign organisms. "His recovery looks good," Dr. Chen reported from the anesthesia station. "All his vital signs are stable, and he should be waking up normally within the next hour." The successful resolution of Jake's crisis provided immediate relief, but it also highlighted the need to re-examine and potentially retreat every patient who had been exposed to Harold's barn. If Jake harbored secondary parasites, the other patients were at risk for similar life-threatening complications. Dr. Hartley's decision to perform emergency surgery on all the remaining patients would require resources that stretched Millbrook Community Hospital beyond its normal capabilities. The Peterson brothers and Tom Martinez would need microscopic parasite extraction procedures similar to Jake's operation, while Harold would require re-examination to ensure his initial treatment had been complete. "We're going to need additional surgical staff," Dr. Patterson realized as they planned the emergency retreatment protocol. and we'll need to bring in more specialized equipment for the microscopic extractions. Elaine found herself coordinating multiple aspects of the expanded medical response while continuing to monitor Jake's post-operative recovery. The crisis had evolved far beyond anything their small hospital had ever handled, requiring improvisational solutions and creative use of limited resources. The State Health Department responded to their request for assistance by sending 2 additional parasitologists and a mobile surgical unit equipped for microscopic procedures. The arrival of reinforcements transformed Millbrook's emergency department into a specialized treatment center for exotic parasitic diseases. Dr. Rebecca Torres, the lead state parasitologist, brought both expertise and resources that proved crucial for treating the remaining patients. Her mobile laboratory could identify and analyze the secondary parasites in real time, allowing the surgical team to plan more precise extraction procedures. These secondary organisms are a previously unknown species, Dr. Torres announced after examining samples from Jake's surgery. They appear to have evolved a symbiotic relationship with botfly larvae, using them as vectors to reach human hosts. The discovery that they were dealing with a new species of parasite elevated the medical crisis to national significance. The Centers for Disease Control would need to be notified, and the case would likely become the subject of extensive scientific study. Harold Brennan's re-examination revealed that his initial treatment had missed 2 secondary parasites. Though his case was less severe than Jake's had been, the extraction procedure was completed successfully, with no complications similar to those his grandson had experienced. "I feel terrible about all this," Harold told Elaine as he recovered from his second surgery. "If I hadn't opened that barn, none of these people would be sick." Elaine sat beside his hospital bed, understanding the guilt and self-blame that often accompanied medical crises involving multiple victims. "Mr. Brennan, you couldn't have known what was in that barn. The important thing is that everyone is getting the treatment they need." The Peterson brothers' procedures went smoothly, with both teenagers showing good recovery patterns after their secondary parasite extractions. Their youth and overall health helped them bounce back quickly from the surgical interventions, though they would need monitoring for several days to ensure complete recovery. Tom Martinez presented the most complex case for retreatment. His extensive original infestation had created multiple sites where secondary parasites could establish themselves, requiring careful mapping and systematic extraction to ensure nothing was missed. "Tom's surgery will take at least 6 hours, Dr. Torres estimated after reviewing his case. We'll need to examine every area where the original botfly larvae were located, plus scan for parasites that might have migrated to other parts of his body." The marathon surgical session that followed tested everyone's endurance and skill. Elaine found herself working continuously for over 18 hours, moving between patients and coordinating care while the specialized medical team performed one complex extraction after another. As dawn broke over Millbrook Community Hospital, the parasitic outbreak crisis was finally reaching resolution. All identified patients had received appropriate treatment for both primary and secondary infestations, and the barn source had been thoroughly fumigated to prevent further exposures. Jake Martinez was awake and alert in his recovery room, with no apparent lasting effects from his life-threatening complications. His successful treatment had required the combined expertise of multiple specialists and the full resources of their expanded medical team. "Thank you for saving my grandson," Harold said to Elaine as she completed her final rounds of the night. "I know he wouldn't be alive without everything you did." The gratitude felt meaningful, but Elaine was more focused on the broader implications of what they had accomplished. A small, rural hospital had successfully managed an unprecedented medical crisis, demonstrating that experienced healthcare providers could adapt to challenges that extended far beyond their normal scope of practice. 3 weeks after the parasitic outbreak that had transformed Millbrook Community Hospital into a specialized treatment center, Elaine Morrison sat in her car in the hospital parking lot, watching the sunrise paint the Montana sky in shades of gold and pink. The familiar sight that had greeted her for 40 years of morning shifts now held deeper meaning, a symbol of renewal and the continuation of life after crisis. Harold Brennan had been discharged 5 days earlier with minimal scarring and a full recovery from his dual parasite extraction. His grandson Jake had returned to school the previous week, carrying with him an unusual story that would likely become local legend. Tom Martinez was home with his wife Beth, grateful to be alive and planning to help establish new safety protocols for abandoned agricultural buildings throughout the county. The Peterson brothers had recovered completely and were back to their normal teenage activities, though they now served as unofficial spokesmen for parasite awareness in rural communities. Their experience had been featured in agricultural safety publications, helping other farming families recognize potential hazards in neglected buildings and storage areas. Dr. Elizabeth Hartley had returned to the university with specimens and data that would contribute to groundbreaking research on symbiotic parasite relationships. Her published case study of the Millbrook outbreak would become required reading in parasitology programs worldwide, establishing their small hospital's role in medical history. The state and federal health authorities had concluded their investigation, with high praise for Millbrook's emergency response. The swift identification of the outbreak source, comprehensive patient tracking, and successful treatment of complex cases had prevented what could have become a regional health crisis affecting dozens of rural communities. For Elaine, the aftermath of the crisis had brought unexpected recognition and validation. Dr. Patterson had nominated her for the State Nursing Excellence Award, citing her leadership during the outbreak as exemplary of experienced professional practice. Medical journals had requested interviews about her role in coordinating patient care during the unprecedented emergency. More personally meaningful was the letter she had received from Jennifer Park, the young nurse who had worked alongside her throughout the crisis. Jennifer's words captured something that Elaine had been feeling but hadn't been able to articulate: the realization that experience and wisdom remained irreplaceable elements of healthcare, regardless of technological advances or updated protocols. "Watching you work during the outbreak showed me what nursing really means," Jennifer had written. "Your calm presence and clinical judgment made the difference between panic and effective treatment. I hope I can develop those skills over the course of my career." The recognition had helped Elaine understand that her recent doubts about professional relevance had been misplaced. The crisis had demonstrated that expertise developed over decades of practice provided value that couldn't be replicated by newer training or more advanced equipment. Her ability to remain calm under pressure, advocate for patients, and coordinate complex care had been essential to the successful outcome. Dr. Sarah Chen had also gained valuable experience during the outbreak, evolving from a competent young physician into someone who could handle unprecedented medical emergencies with confidence and skill. Her collaboration with Dr. Hartley had expanded her knowledge of exotic diseases and reinforced her appreciation for the institutional memory that experienced nurses brought to challenging cases. Marcus Williams had been recognized by the hospital administration for his behind-the-scenes contributions to the emergency response. His anticipation of resource needs and coordination of support services had enabled the medical team to focus on patient care while ensuring that necessary equipment and supplies were always available. The barn where the outbreak had originated had been demolished, and the site treated to eliminate any remaining parasitic organisms. Harold had decided to sell the property rather than rebuild, using the proceeds to establish a fund for agricultural safety education in memory of his late wife. The gesture transformed a source of tragedy into something that would help protect other farming families from similar dangers. As Elaine prepared to begin another shift at Millbrook Community Hospital, she reflected on how the parasitic outbreak had changed her perspective on her career and her value as a healthcare professional. The crisis had required every skill she had developed over 40 years of nursing practice, clinical expertise, patient advocacy, crisis management, and the kind of intuitive understanding of human needs that came only with experience. The hospital had returned to its normal rhythm of routine medical cases and quiet night shifts, but something fundamental had changed in how the staff approached their work. The successful management of an unprecedented crisis had created confidence that they could handle whatever challenges might arise, regardless of how unusual or complex they might appear. Elaine's worn nursing badge still showed the scratches and dulling that came with 4 decades of service, but now she saw those marks as evidence of experience rather than signs of obsolescence. Each mark represented patients she had helped, crises she had navigated, and knowledge she had gained through years of dedicated practice. The automatic doors of the emergency entrance slid open with their familiar sound as she entered the hospital for what felt like both a routine shift and a new chapter in her career. Whatever medical challenges awaited her, she now understood that her years of experience were not a burden to be overcome, but a resource to be valued and shared with colleagues who could benefit from her wisdom and expertise.